historically, there's a lot of controversy around hypnosis. And I do believe that that's part of the reason that the research is lagging. And what I would say is that it's really important to demystify it, learn about it, and then see if it's for you. See if it's maybe for your patients. There are no side effects. So there's that.
Dr. Sarwar, I am delighted to have you here today. We're going to be talking about hypnosis for sleep. This is a really popular topic, and there's also a lot of skepticism about the role of hypnosis. Is this even evidence-based? So we're going to get into all of that today. But before we start, could you tell our audience a bit about your background and what you do?
My name's Nadia Sarwar. I am a double board certified pediatrician and palliative care physician. And I actually started learning about hypnosis maybe a few years ago when I became really interested in helping my patients that were sort of frequent flyers that would come in with chronic abdominal pain and headaches. And it turns out that a lot of what they were dealing with was stress. And so I started by studying mindfulness, and then I came upon clinical hypnosis, and then just loved it and found it to be such a powerful technique. So I trained and certified in it, and now I have my own practice where I see kiddos for clinical hypnosis, and I also coach their anxious parents.
We'll talk a little bit more about the training and what that looks like, because I know some people listening might be interested in getting certified themselves in using clinical hypnosis in their practices. So we'll come back to that. But I'm curious how you even thought about doing hypnosis with your patients. Was that something you personally experienced, or did you see it in practice? How did you get into it?
No, to be honest, it was never taught to me in my training, although in some residencies now they are trained somewhat in clinical hypnosis. So I actually came across it honestly when my own child, school-age child, started to struggle with anxiety. And we bounced around between psychologists, psychiatrists, and then our pediatrician referred us to somebody that practiced clinical hypnosis. And so I was just fascinated with the technique and saw how it helped my son. And I was able to decide that I wanted to train in that as well.
We'll talk a little bit about the evidence behind it. But first, what is hypnosis? Is it different than hypnotherapy? Are those terms interchangeable? I know people, when they hear the word hypnosis, they might think about stage hypnosis, right? So the person in Las Vegas who goes up on stage and they're made to quack like a duck or sing like Elvis or that type of thing. So what are we talking about actually when we're discussing hypnosis? What is it?
Hypnosis has gotten a bad rap historically, and I want to acknowledge that right away. It would be a lot easier for me actually to promote my practice by saying I teach guided imagery and mind-body techniques and stay away from the word entirely, as many people do actually that are practicing hypnosis. It's important, really important to demystify hypnosis and also to be really clear about what you're providing as a clinician. So hypnosis is just a state of inward absorption and deep concentration. I tell my kids, my patients, that hypnosis is like daydreaming on purpose and with a purpose, and the purpose is to feel better. Okay. What hypnosis is not is also really important to say. It's not sleep. It's not stage hypnosis. It's not for entertainment. I'm not going to make anyone quack like a duck, and I'm not going to wave around a pocket watch either. And it's also not mind control. Patients are very much in control the whole time. In fact, if anything, hypnosis is about teaching kids to be more in control of their own mind, which when you have anxiety, it can feel really out of control. So hypnosis can be a really empowering technique for these kids and for all patients, really. I keep saying kids. I'm a pediatrician.
No, I think that's really helpful, and I love how you said that hypnosis is daydreaming on purpose.
It's like daydreaming on purpose and with a purpose. And the purpose is to feel better. So it might be relaxation for some patients that have anxiety or insomnia. The purpose might be altering sensations, or it might be promoting self-efficacy over habits or behaviors that someone wants to get rid of.
And to clarify, is hypnosis the same as hypnotherapy?
You know, some people use the terms interchangeably. When I say hypnosis, understand I'm referring to clinical hypnosis. And the distinction is, whereas hypnotherapy, many hypnotherapists are wonderful. There is, however, not a lot of regulation around hypnotherapists. So when we say clinical hypnosis, we're referring to hypnosis as practiced by physicians, nurses, psychologists, or other healthcare professionals. And I think that distinction is important because as clinicians, we're answerable to a board. They're certifying bodies that are making sure that we are staying within our lane.
That's a really helpful distinction. Thank you for clarifying that. Okay, so let's talk about the role of hypnosis for sleep, specifically insomnia. Can you tell us a bit more from a neurobiological perspective? What's happening to the nervous system with hypnosis? And then we'll get into some of the evidence and clinical applications after that.
Yeah, absolutely. So, what I see in pediatrics, and I think also many adults feel this, is that their nervous system is in a state of hyperarousal. And so, you can't really talk a person out of hyperarousal. But what you can do is empower them to alter their inner state on their own. And so, hypnosis is a much more experiential treatment where a patient can actually alter their physiology and go from a state of dysregulation or sympathetic nervous system activation to a more relaxed state.
And that would be especially helpful for people who are struggling with insomnia, where hyperarousal is often a contributing factor to it, and of course,
Absolutely.
anxiety. So is this an evidence-based practice? I know there's probably a lot of skepticism out there. How do you talk to people about this, and what is the evidence behind it?
Absolutely. There's emerging evidence of the utility of hypnosis in anxiety and sleep. And there's actually the strongest evidence for hypnosis is in other disorders. So pain disorders, procedural anxiety, and there's actually a lot of strong evidence in patients with functional GI disorders. So a lot of the really strong evidence is in other areas right now. Part of the reason is I think it's easier to sort of measure the outcome in some of those other disorders. And then the other thing that I would say about hypnosis in terms of the research out there is since hypnosis is so experiential and it's so clinician dependent and it's very much tailored to the individual patient, it is hard to sort of standardize it. And so I think that's part of what makes it a little more difficult to study. I'll give you an example. If I tell one patient, imagine you're laying on a cloud and with every breath you sink further into the cloud. For some patients, they love that, right? They choose it for themselves. I say, what do you want to imagine about your sleep? And they say, I'm on a cloud. It smells like cotton candy. For other people, they're afraid of heights. They're going to say, oof, that pushes me further into hyperarousal. So coming back to just, creating studies that's part of what makes it challenging is it's so dependent on the clinician's techniques and also the patient and what they're looking for.
That makes a lot of sense. And for anyone who's interested in learning more about hypnosis for GI disorders, I do have a video with Dr. Ellen Joseph. She is a clinical hypnosis specialist and she specializes in GI psychology. So I can link to that if anyone wants to learn more about that.
Yeah.
Great. Okay, you're going to need to tailor the hypnosis intervention to the patient, taking into account what might be going on for them. And of course, if there's any history of trauma, if there's phobias and fears, like you just mentioned. I'm curious how you might approach clinical hypnosis with a patient who comes to you for sleep issues. First of all, are they coming to you because you do clinical hypnosis? Or is it something that after an assessment you would determine is appropriate for them?
Yeah, patients are coming to me the way you would come to a subspecialist. So they're being referred by pediatricians or often by other patients that have found relief from clinical hypnosis.
I'm just curious if you could walk us through when you're working with a patient, whether it's a pediatric or an adult patient, and you're going to be doing clinical hypnosis with them, and let's say they're dealing with kind of a chronic insomnia disorder. Where do you start? Are you starting with an assessment? Do you start with tools? Can you just walk us through what the process looks like? As you can see, there's a lot to learn when it comes to clinical sleep medicine, and we're just scratching the surface in today's interview. If you are a physician or a health practitioner who wants to learn more about clinical sleep medicine in a practical way that you can use in your everyday clinical work, then get my free sleep mini course. I'll put the link to that in the video description below. You can also get it at intrabalance.com/doctors.
For me, the first visit is always about building rapport. And that's always important for us, but especially with kids, because oftentimes they are brought in by their parents. And so we want to make sure we understand what their motivation is, because I'm there for my patient, right? And so the first thing I do is assess sort of their readiness for treatment. Like, how motivated are they? And before launching right into, I don't teach hypnosis usually on the first visit. So the first visit is usually about 60 minutes, and the whole time is just getting to know the kiddo. Because then I also know what I will utilize in hypnosis, like what are their likes and dislikes. The other thing that is really important in that first visit is to create some positive expectations. And I'll tell a little story about this. It's a patient that actually came in not with insomnia, but habit cough, but it really illustrates the importance of creating that positive expectation. So this kiddo came in with habit cough, had been to all the specialists, had all kinds of workup, and nothing was medically wrong. The cough would go away while they were asleep and was there during the day. And the parents were beside themselves by the time they came to me. And I did what I usually do. And at the end of the visit, I asked the patient, I said, you've really been through it with this cough. Oh my goodness. How are you going to celebrate when you get rid of it? I wonder what you're going to want to do. And he just looked at me. Nobody had asked him that. I said, I have no idea. Right? And after discussion with his parents, they agreed to buy him some $100 Lego set that he's been after. And they left to come back in a week to learn hypnosis. And by the time he came back the next week, the cough was already gone. Now, to be clear, that doesn't always happen, right? But I love that story because it emphasizes the importance of creating that positive expectation of hope that we create for our patients. And equally so, by the way, for a child, in the parents. Because parental anxiety really plays into things too, right? As we know. And so that's really important that we do that. So that's sort of what the first visit looks like, is really rapport building and creating positive expectation, and maybe some work on how the patient talks about sleep, right? So the words that we use around sleep are really important too.
I'm so glad you shared that example because it does speak to the power of, like you said, the words that we use and shifting the patient's mindset around what's going on, shifting it more towards a problem solving, a positive sort of mindset, and really leveraging that placebo effect. And that's quite a powerful thing to do in sessions. And you don't need any special training to do that. Every physician, every clinician can do that.
That's right. Everyone can.
Okay, so the first session is then the assessment, building rapport, you're getting to know the patient. When you start the clinical hypnosis program or protocol, what does that look like? How many sessions is it typically? And are you doing it live in session with them with recordings, or how does it work?
Yeah, great question. So I want to say also that in the first visit, I also make sure that the patient is up for it, right? So because I see kids, I tell them what I do, and then I ask them, so do you want to hire me? Right? And so it's very important to always honor the patient's power in all of this, because often patients are feeling powerless when they come to us, right? So once we've done that and they've agreed, then the next visit, I would usually teach them a form of hypnosis. And one of my favorites is Special Place, which is basically imagine a place where you feel relaxed and happy, and we engage all the senses, and then make some suggestions that are in line with the patient's goals. And so suggestions for health, suggestions for good sleep, for empowerment, for self-efficacy. In terms of how many sessions, I usually tell patients to give it at least 4 sessions to see if it's helping, like before they decide. And somewhere in the range of 4 to 8 sessions is what I ask patients to plan for. Each session is usually 45 minutes to an hour, depending on the child's attention span and the amount of time that they're able to give. I see patients also, I want to say, in person and virtually. So hypnosis can be done virtually. I find it more challenging in younger patients, but in older patients, it works quite well.
And then are you giving them recordings in between sessions or like just to
Not
practice?
usually.
Okay.
Not usually. And so part of this is because I really want to empower the patient that they don't need my voice, that they're doing this on their own. I generally don't give recordings. So now and then for a patient, if they request it, if they're having trouble getting there and they're telling me, it feels so good when I'm in the office with you and I can't do the same at home, then I might give them a recording. One of my favorite stories is I had a 6-year-old who actually had insomnia. And so she had asked for a recording. I gave her a recording and she would play it on her phone every night. And so one night the recording wasn't working, whether it was poor Wi-Fi or what. And she was so upset. And her brother, who shares her room with her, that's a couple of years older, just started reciting my hypnotic practice, right? And so he said, "Hello, so and so, are you ready to go off to your favorite place?" And I just love that story. The mom came back and told me that story later because, it really truly is such a joy to see kids responding or to see patients responding to the techniques.
That's such an interesting concept, too, because it tells us that this process of hypnosis is actually a skill that people can learn and implement for themselves,
Absolutely.
right? It's not just like it's not a passive thing that they need something to listen to, and it's not reliant on somebody else. So it
Yes.
shifts that locus of control from the external to the internal. I think that's so interesting.
Absolutely. We tell patients all hypnosis is self hypnosis. I'm teaching you a skill that you can use to help yourself feel better. And when they come back feeling better, it's not, look what we did. It's, how did you do that? Well, look at what you can do.
And what an incredible thing to teach a young child, age
Absolutely.
6. That's amazing. And so I'm curious, just along those lines, what other sorts of results have you seen with people who have insomnia, whether they're pediatric or adult patients? Because I'm thinking about the clinician, maybe the psychiatrist or the PCP who's working with somebody who has insomnia. Maybe that patient is taking sleeping pills. Maybe they've even done CBTI and it hasn't really gotten them the results that they're looking for. At what point should they refer, and what can they tell their patients to expect?
So again, I want to emphasize that and this can definitely translate to adult patients as well. But to be clear, I don't see adult patients. And this is a really important concept with clinical hypnosis, is that you want to stay in your lane. Now, I do see people up into their early 20s because I still sort of consider them kids. But beyond that, it's sort of beyond the scope of my practice. But what you see in patients is they have, not only is there a state of hyperarousal that hypnosis can be very helpful for, it's also a lot about like just the anxiety around sleep and that loss of control and that sort of powerless feeling as you get closer and closer to bedtime. And so empowering them changes sort of that outlook around sleep, changes the story they're telling themselves around sleep. And that's really powerful and important. And I'll say in my practice, in kids, what parents report, as soon as the kids learn hypnosis, one of the first things parents notice is that their kids are less clingy at night. They seem more confident. That the parents can finally just say good night and actually walk out the door. And and that is sort of the first thing that you see. Yeah,
I'm sure that's music to many parents' ears, the reduction in the clinginess at bedtime.
absolutely, absolutely, and also being able to stay in bed. For kids, and it's interesting because I know that for adults, it's important to not spend extra time in bed. So sometimes the counseling is, if you're awake for a long time at night, get out of bed. In kids, we want sort of the opposite because in kids, they want to get out of bed, right? Because they want to go to that source of safety, which is their parents. So as soon as they wake up, they go to their parents' room. And what this does for kids is it empowers them by creating that locus of safety within themselves, by creating a sense of internal safety. Yeah. And so that they know that when they wake up, well, you can take care of yourself. And here's how.
In terms of suitability, who's a good candidate for clinical hypnosis? And are there any contraindications? Anyone who's not a good candidate?
Yeah, great question. Kids do really well with hypnosis. Anyone over the age of 5, I've seen kids as young as 4.5 if they really have a good attention span. And then there really is no age limit to who can use hypnosis, although there is a peak age of hypnotizability, we say, which is between 7 and 12 years old when they still have that wonderful imagination and are also able to pay attention for long enough to reach that level of absorption. So that is perhaps where it can be most effective. And then there are certain traits that I think patients have, or in my practice, what I've seen is that patients that tend to respond really well to hypnosis tend to be patients who are really open to sort of a more experiential treatment, creative people, and maybe people who are not very concrete and analytical, if that makes sense.
Yes.
In terms of the contraindications, that's really important too. First of all, you really want to stay in your lane. So if you're a pediatrician, then you should be treating kids. And then some of the contraindications, as in many things, you want to exercise caution with patients who've suffered trauma. So unless they are stabilized, adequately resourced, you want to exercise caution with trauma. And then also dissociative states. The same goes for patients who have not been stabilized in dissociative states.
Okay, that's really helpful. And I know some people might be wondering, well, what's the difference between clinical hypnosis and meditation or guided imagery? What is the difference?
Yeah, so they're actually very similar. And I do think that at times what people call guided imagery is hypnosis. So hypnosis, again, is just deep inward focus. And so guided imagery at times, I want to say it's just a label. But what I would add is for the clinical aspect is we are making suggestions that are in line with what the patient wants to achieve. So if you want to feel better, if you're, for example, for functional GI pain, for IBS, we may offer suggestions for reducing discomfort. And we may tell the child that when they find their control panel, they're able to turn down that suggestion. So the addition of a therapeutic suggestion is definitely one difference between guided imagery and hypnosis. The other difference is when you see a clinician, whereas guided imagery often is sort of standard. You know, we've all imagined staring out at an ocean or a stream as it passes by us. Hypnosis is individualized to the patient. So I'm creating an experience for my patient. And for example, if a kid loves Minecraft, then I'll throw Minecraft in there. And, so that is another difference between guided imagery practice and hypnosis.
Okay, yeah. And so are you mostly seeing patients for anxiety or insomnia? Who is being referred to and for what reasons?
The majority of patients I see have anxiety in some form or the other. They may have a phobia that the parents would like them to feel better about or the patients want to get rid of. I also see kids for tic disorders respond really well to hypnosis, habit disorders. I could go on and on because really my personal bias is that everyone could use it, should learn it. But really anything in which you think there's a stress component, which, as you know, is most things now.
I agree. I think this is a skill that most everyone should have. So I'm thinking about the clinician. At what point should they refer? If they are seeing that that patient has anxiety or insomnia or, something else that could use the support, should they refer them right away? How can they assess that patient's level of readiness? For the referring clinician, like, what do we do? When do we send our patients to you?
Yeah. Well, I would say that most patients get referred to me once they've tried a few other things, and that's fine. However, I do feel that it's something that can be offered, especially to patients that maybe are not responding to CBT, are not responding to the behavior changes and the thought work, then that's a great candidate to learn this as an adjunct. When I see patients for insomnia, I'm not just teaching hypnosis. I am also working on the other aspects, including the behaviors, including how they talk around sleep. So all of that is really important. And then, of course, the patient's openness to the technique. Not everyone right away would be open to it. So I think that if they're open to it, it's a great technique.
What do you think about some of those apps that are out there? I've seen some apps like Reverie and things like this for clinical hypnosis. Are those effective? What do you think?
I'm not familiar with Reverie, actually. I don't see a reason why someone couldn't use an app as long as it's being used responsibly. Don't listen to it while you're driving. I think what an app might miss out is that individualization for the patient. But if there's options out there, I think that's worth using.
Yeah, that's my approach as well with anything that's app related, really, is that they can be a good way to explore that modality or to give you support between sessions. But working with somebody like yourself one-on-one, if you want more personalization, that's really the way to go. Even with CBTI for insomnia that we do in our practice. But an app isn't really a substitute, but it can be a great adjunct for treatment.
I hope it's not. I hope it's not a substitute for us.
Okay, so what about clinicians who might be interested in getting trained in clinical hypnosis? What was your journey? What would you say to the person who might want to get certified in it?
I am happy to talk to anyone that's interested in learning more. There are two main certifying bodies for clinicians in the United States, and one is the American Society of Clinical Hypnosis, which is for adult clinicians and pediatric clinicians. And then the second is where I trained and completed my certification. That's the National Pediatric Hypnosis Training Institute. We call it NIFTY. And I am now faculty at NIFTY. Our next conference or training conference is in mid-October. And if anyone's interested, I will be there. And I'm happy to tell you more. It is life and career changing, and I highly recommend it. There's 3 main levels of training. You don't have to complete them one after the other. You can come back and attend fundamentals a couple of times before deciding to move up a level. But between attending the trainings and then also using it in your practice, then you can proceed to, if you like, to the process of certification.
How long does the certification take?
I think it probably took me about 5 years, but if I had gone straight through the conferences, you could potentially certify within 3 years, as long as you're using it regularly in your practice.
So what's one thing that you always do in the 30 minutes before bed?
In the 30 minutes before bed, okay, if I can keep myself from doom scrolling. No, I mean, sleep is really important. I recognize that in my own life. And there have been some really impactful things around sleep that have made a difference for me. And I think one of the most powerful things is how I talk about sleep to myself, right? Just like I teach my patients. I am going through menopause right now. And so I have a lot of restless nights just because of hot flashes and things like that. So before I go to sleep, I have some choices. I can tell myself how tired I am and how I really need to get sleep, and I have such and such thing coming up tomorrow. I'm about to be on a podcast with Dr. Popal. Or I can tell myself, oh, my bed is so comfortable. And I love getting in my bed. I'm so tired all the time. That's part of it. I can focus on how comfortable my bed is, what a blessing it is. Safety is a blessing. The comfort of your blanket over you is a blessing. And I can tell myself that the fact that my husband is still in the bathroom brushing his teeth doesn't have to bother me. If he wakes me up when he comes in bed, I'll just roll over and fall back asleep. So I think I've gotten a little less grippy about my sleep, if that makes sense. I used to sort of like snap at my husband, he woke me up, right? And now I tell myself, I'll just turn over and go back to sleep. And it's true.
Wonderful. If people want to refer patients to you, how can they find you?
My practice is called Mumta Wellness. That's MUMTA and then wellness. And so you can reach me just through my website. And I'm happy to see anyone in the state of California. I can only see kids in California right now. That's because of my license. And but I do coach parents as well who are dealing with anxiety in their kids. I found in my practice and in my own life that it's really important to address parental anxiety as well.
Excellent. We'll put the links to your website in the video description underneath this video. So for anyone looking for support for pediatric patients in California, you can refer to Dr. Sarwar, and then parent coaching outside of California as well is available. Thank you so much.
Thank you. Thank you so much for having me. It was a pleasure.